next presenter is from Group 1, and it's Dr. Ross Clark from Australian Catholic University with the title Bridging the Gap Between Physical Function Assessment in the Laboratory and Clinical Settings. Ready when you are.
Thank you. So the video you can see here is something that I call beautiful from a biomechanics perspective. This is from a three-dimensional motion analysis laboratory session, and what we do is place markers on a person's body and get them to perform some functional tasks like walking, jumping and hopping. This gives us really precise information about things like step lengths, joint angles and centre of mass sway during functional tasks. This is fantastic, but in many ways useless. This is the ugly part of three-dimensional motion analysis. In these pictures you can see in the top, that's a 3D gait lab. So all around it we have cameras. Each one of those cameras typically costs somewhere between $20,000 and $25,000. Force plates in the ground, computers and cables, lots and lots of cables. Underneath it we have the person set up to do this sort of motion analysis. They have markers placed on their body. This isn't always feasible in clinical settings because it can take 15 minutes to half an hour to set people up, and to take everyone's clothes off just doesn't work. So this is a problem because we have very limited translation of these sort of tests into clinical practice. So our gold standard just doesn't get used to inform clinical decisions. However, some of the recent advances in low-cost technology could actually change this, and this is where I get very excited and focus my research. So my background is in biomechanical assessment, looking at movement of the body in a laboratory setting, but I didn't like how we couldn't translate it. So now I look at some of the low-cost technology that's come out and see whether we can use it to get similar information to what our laboratory does. So for example, the Microsoft Kinect, which is a video gaming device made by Microsoft, costs under $200. Compare that to a typical $200,000 for a motion analysis laboratory. The beauty of the Kinect is it uses artificial intelligence algorithms, so it can automatically track the person's body in 3D space. So we don't need markers. We do this test in people with Parkinson's disease, stroke, etc., and it can take 15 to 20 seconds to do the test versus half an hour in prep and then up to a day of post-processing. So we can get information very, very quickly. Another beauty of it is availability. A lot of places already have it as part of their rehabilitation practice, or you can purchase it from places like Big W or Kmart instead of having to buy it online and waiting possibly 2 to 3 months to set it all up. But are these systems any good? That's where I have a lot of interest. So I'll just show this one for example. That's a Nintendo Wii balance board. Probably half the people in this room have it sitting under their coffee table at home. They sold over 50 million of these worldwide, and they're good fun, but they wear out pretty quickly in terms of enjoyment with the games. However, when I got one, I pulled it apart to see what was inside it, and it was very, very similar to what's in our laboratory force plate, which costs about $20,000. The Wii balance board costs less than an entree at a typical restaurant, is around about $20 to buy nowadays. So, pulled it apart, had a look and realised, wow, the sensors in this are fantastic. Did a validation study, the first one ever published, and showed that it was as good or even better than some of our $20,000 force plates. And that made me really excited because our force plates are typically 20, 30 kilograms, cables, computers, whereas that's completely wireless and can be set up anywhere. So once we do that validation, can we get sway measures from the balance board? Can we get step lengths from Kinect? Can we get joint angles from smartphones? We look at the utility assessment, and that's important because just because I can get centre of pressure sway from a balance board doesn't actually mean that it's useful to a clinician. So we compare it to a standard clinical test to find out whether the information it gives us more important information over and above a standard clinical test. For example, if we do a 10-metre walk test, which is standard in clinics, measure how fast someone walks 10 metres with a stopwatch, that is good, it predicts falls. If we have the Kinect and look at step lengths, centre of mass stability, does that give us more information? Can we predict falls better than with the standard test? And that's where it leads into my passion, which is the integration of these systems into standard practice. I hate that our biomechanics laboratory is so good but used so little, and I want to try and translate that into the clinical setting so it's actually useful to patients. So this last slide just gives a bit of an idea of how I'm sort of using these systems throughout the world in research and also clinical settings. Pretty much every clinical population I'm involved in at the moment, and we're using it for things like mass screening. So in Singapore with the Health Promotion Board, we'll take the balance board out to their daily screening sessions, and we can test hundreds if not thousands of people in a day with instrumented balance. To put that in perspective, that makes it the largest balance study ever done when we do that sort of thing in one day. outcome predictions. So we can test people before surgeries, for example, knee surgery, and predict what will happen 6 months later, who will have poor outcomes. We can use it as clinical trial tools, pre and post RCTs, a bit more of a sensitive measure than standard tests. And what I'm really interested in is treatment guidance. If we notice someone with balance impairment, can we fix that and optimise their outcomes? Thank you.